My name is Andrew Fuller. I'm with the Witness and Society Office based in Washington, D.C., with the ELCA churchwide organization. And we are here today to be discussing Medicaid and recent threats to healthcare programs, how that intersects with our Lutheran values, and basically different calls to action. So hopefully what we hope to gain out of today is to make sure that everyone feels better equipped with the current layout of the land and how we can sort of take action as a collective community. So let us start with a quick prayer, and I will get us started. Gracious and merciful God, we gather here today as your children, concerned for our neighbors and communities. Guide our conversation, sharpen our understanding, and strengthen our resolve to be voices for those whose voices often go unheard. Remind us that our call to love our neighbor includes advocating for healthcare access for all people, especially the most vulnerable among us. May our time together bear fruit in faithful action. In your name we pray. Amen. All right. And with that, I think we can go ahead and get started. I'll just go through some technical details. You will see, and I hope, a Q&A option in the chat. Please use that as this panel goes on, as we hear from our speakers. Put your questions as they come in, and upvote the questions that you think you would like to hear read out, and we will get to those at the end of the call. And then on top of that, just to go over our technical details of the meeting, we are hoping to cover a greater understanding of Medicaid, the current situation in Congress, our Lutheran theologies on this matter, and opportunities to respond. And so let me go ahead and introduce our speakers. On my side, you will see Sue Polis with Lutheran Services in America. Sue is the Vice President of Public Relations and Government Affairs at Lutheran Services America. Prior to joining LSA, she was the Director of Health and Wellbeing for the National League of Cities and is just a master of healthcare policy writ large. And also a healthcare master is Katie Adams joining us. Katie previously worked for the United States Senate on health policy and has previous experience convening stakeholders and fostering balanced discussions on complex issues. I used to know her when she was working at the United Church of Christ in a prior role, and just has an amazing voice speaking on healthcare issues as well. And so I'm grateful for both of you for joining us. And with that, I will turn it over to you, Sue, to get started on discussing just the sort of understanding of Medicaid writ large.
Oh, thanks, Andrew, and great to be with you all today, and thank you for the opportunity. As Andrew said, I oversee our government relations and public affairs work for Lutheran Services in America, and certainly been spending a fair amount of time getting our members activated on Medicaid. So Andrew asked me to just kind of start today giving you a little bit of a sense for how Medicaid looks across the Lutheran Services in America network. And I'm going to share just a couple of slides. I do need permission to share my slides. Sorry, I didn't test this in our... let's see.
You should have it now.
Okay, thank you. So hopefully everyone will see this. Can folks see that?
Yes, thanks.
Okay, great. So Medicaid, why does Lutheran Services in America care about this, right? This has been a longstanding priority for our members across the network. Of course, our network serves all the populations within Medicaid, including children and families, people with disabilities, and older adults. So this has been a longstanding priority because it represents the work across our network, perhaps in a way no other program really does. And you know, in view of that, right, we have really been trying to focus on, you know, a number of challenges within Medicaid at this current time. And I know Katie's going to talk about this in more detail, but I think just to set up how we've approached this with our members, you know, what's different this time with Medicaid is that this isn't really a fight about Medicaid. This is a tax bill. right? This is the threats to Medicaid are coming through the expiring Tax Cuts and Jobs Act, where there's estate tax cuts that were temporary and individual income tax cuts that were temporary, and they're trying to make those permanent. And so there needs to be a way to pay for those tax cuts, especially focused on the wealthiest Americans. And so that's really where Medicaid is entering this conversation. And so as we've been approaching this with our members, right, 80 million people are now enrolled in Medicaid, right? We saw an expansion through the last 4 years of the Biden administration. That expansion population, as you can see here, right, has included more adults. So you can see, even though it serves seniors and children, you can see where the costs where the costs come in, right, and how Medicaid has expanded. And so that's why it has surfaced in this conversation, and I know Katie will talk more about the reconciliation process, so I'm not going to go in detail there. But basically, the House and the Senate, they're trying to find, a significant amount of dollars to pay for those tax cuts. And Medicaid is a target because simply it's one of the programs with that sort of a budget, right? And for Lutheran Services, the way that we think about Medicaid is really as part of our access to care, our broader access to care viewer lens, right? Because we know Medicaid payment is one of the ways in which we employ our workforce, right? So payment and reimbursement become really key because our members have already, especially our members in rural areas, face great workforce shortages, right? So the threat to Medicaid is not just to the people our members serve, but also to them as employers, right? Because if we have people, working age adults on Medicaid, if they lose that coverage, right, there goes the preventative services and so forth and the coverage that people need to move through and live their daily lives. So we really view it through that broader access to care and workforce lens. And then, of course, we've been doing a lot of work with Andrew also on housing as it relates to people's health. And so that's been another core area of work where we've been partnered with the ELCA. So what's changing, for in the environment, right? I probably don't need to spend a lot of time because you all are probably feeling this in similar and perhaps different ways in your communities, right? But this conversation around cuts to Medicaid comes at a time, certainly, when state budgets are under more pressure, right? We've had the American Rescue Plan Act funds that are now gone. State budgets in many states are finding themselves in really tough times, right? So if there's cuts to Medicaid at the federal level, it's going to push more burden at the state level at a time when that flexibility, I don't know if it's ever there, but it's a harder time now, right? And certainly we saw during President Trump's first administration some really good things and some challenging things, right? They tried to broadly repeal the Affordable Care Act. There were over 60 attempts to do that. What's different now is that they're not taking the hammer, at least, to the Affordable Care Act, right? This is a scalpel approach. And so finding ways to cut Medicaid, there's a lot in different ways that you can cut Medicaid. And I think Katie will speak to that. So I'm not going to spend time on that. We certainly have a new Congress with smaller majorities. So for our members, we're really trying to focus on the House first and foremost because there's such a slim majority in the House. And they're trying to move this through a budget reconciliation process. Again, Katie will speak more to that, but that's a fast track way where you only need a simple majority rather than full votes, right, in the House and Senate, and then and so forth. So they're trying to do this in an expedited way. And right, I talked about the need for pay-fors through the Tax Cuts and Jobs Act and how Medicaid's in the bullseye. And so part of our strategy with our members is not just protect or defend Medicaid from cuts, but we have to strengthen Medicaid. We know in the shift to Medicaid managed care, our members are involved in a lot more value-based contracts, right? And we don't want to lose that momentum, and we don't want to lose the flexibility that's come through Medicaid and Medicaid managed care and value-based payment approaches to serve people's more holistic needs, so that their health costs are lower, right? We can address food insecurity, we can address transportation and so forth, knowing that if people can make their appointments and stay on track with their health, that's going to reduce costs in the long run. So we want to both defend and strengthen Medicaid, and that's sort of our approach. And where are we focused? We are focused very much on key committees with jurisdiction, right? So the House Energy and Commerce Committee is really the committee that's going to be in charge, right, of identifying what health programs are cut in order to meet the target the House has set as part of budget reconciliation. So if you have members in your states that are on the Energy and Commerce Committee, and even more specifically, the Health Subcommittee as part of that committee, those are the folks we need to be talking to early and often. House Ways and Means as the Tax Writing Committee and other tax considerations that are part of this mix, and then ultimately the appropriators, and then in the Senate, while the House certainly is where we're putting more emphasis, the Senate is still important, right? So the Senate Health, Education, Labor, Pensions Committee has jurisdiction in the Senate Finance, again, the tax writing committees, with being that this is a tax bill, right? And the appropriator. So I'm going to pause there, and I'm going to turn this over to Andrew and Katie for the next portion.
I'll turn it right over to Katie. Go ahead.
Hi, everyone. My name is Katie, and like Andrew said, I've worked in federal healthcare policy for quite some time, and I'm here to talk about budget reconciliation and Medicaid and what's really at stake. And I know that budget reconciliation sounds like something that should come with a nap. But I promise the process really matters, and understanding it is key to understanding the real impact that it has on millions of people. So I'm here to kind of help break it down in a way that makes sense. Budget reconciliation is a fast track that Congress uses to make changes to spending and revenue. So if you've ever been to Disneyland or an amusement park, you can buy a fast track pass. And that's how Congress is approaching budget reconciliation. There's a process that they go through, and the reason they like it is because it's easier to get something through. It only requires a simple majority in the Senate, 51 votes instead of 60. So it's a really powerful tool for pushing through major policy changes if you don't have bipartisan support. It's been used by both parties over the course of the, 50-year history of the Act. There have been 23 budget reconciliations over the past over 50-year history of the Act. It was a result of the 1974 Congressional Budget and Impoundment Control Act. I know, I told you this would be exciting. But I think it's really important to understand how Congress works in order to be able to, make impact. And so this is why we do this. Reconciliation has been used, like Sue was just talking about, for the Tax Cuts and Jobs Act that was passed in 2017. It's also used for the American Rescue Plan in 2021, the Inflation Reduction Act in 2022. And it follows a pretty structured timeline. So Congress passes a budget resolution, which is, setting spending limits and revenue limits, and it includes reconciliation instructions, which direct committees to cut spending or raise revenue. So this is the budget committee's this is how much we want overall to spend, and then all the committees go, okay, this is how we're going to do it. This is a very high level overview. Different committees draft different reconciliation legislation, and this is the actual policy changes that are based on the present budget resolution. So I'm going to get into Medicaid a little bit in a minute, but this can mean instructions on capping spending or adding work requirements or cutting provider payments. Each committee then sends its work to the budget committee, compiles it into a single bill. It's the world's hardest group project. And then the House and the Senate debate and vote. This is what we just had happen. So the House passed a budget reconciliation bill, and they were like, we want to cut 880 billion out of the House. See, I'm so sorry. I have a cold. The out of the House budget, especially in the kind of the Medicaid space. And yes, energy and commerce. Thank you, Andrew. And then the Senate passed a different budget, and the Senate had different instructions. So the House and the Senate now have two different versions of the budget. So now we're at something called the conference committee. And I think it's important for everyone watching to realize that reconciliation is not done and dusted. And so this is one of those kind of points where you have an opportunity to contact your member of Congress. A conference committee is formed, and this is where folks from the House and the Senate come together, and they're lawmakers from both parts, from both chambers, and they negotiate a final version. And this could take very little time, but this probably will take a lot of time. If I were a betting person, I would bet that this could go through the end of the summer. And so, because there is a very wide gulf in between how the House and the Senate have approached budget reconciliation. But just to go through the whole process, I'm gonna tell you, if there is a conference committee, then they would come together, they would pass a bill, and then it would go to the president for signature or veto. We aren't there yet, and we're in the part where the House and the Senate are talking to each other. So you're hearing a lot about Medicaid because lawmakers are looking for spending cuts, also called offsets. When the federal government reduces revenue, like through tax cuts, they have to find ways to cut spending elsewhere. So House Republicans have adopted a budget blueprint that instructs House Energy and Commerce to cut spending in its jurisdiction by 880 billion. And I think another kind of thing to really noodle on is the idea of there being 880 billion available to be cut from these like social safety net programs. So you're gonna hear a lot about kind of waste, fraud, and abuse, and whether or not folks are saying, yeah, we're not gonna cut programs that really impact people. We're just gonna go after waste, fraud, and abuse. And I think a lot of you already know that, Medicaid is already pretty difficult to access, and there's already a lot in place, looking at, making sure that people are in the program because they're supposed to be. It's a well-run federal program. They've kind of already skimmed it down as much, when you're like cutting like a good piece of meat and you cut all the fat, they've skimmed all the fat off of the Medicaid program. It's also, I think, an important question to think about. When you look at like a program that's run well and is doing a good thing, if you go after it for waste, fraud, and abuse, which I think we can all agree, it's important to make sure that these programs do not have that. The money should be reinvested back into the program then, if it's found. And that's not what they're being directed to do. And so, you're going to hear lawmakers saying, we're looking, we really just want to make sure we're trimming the fat. They're looking for a way to pay for the tax cuts that they want. This is what it is. So when you hear people talk about Medicaid, it's not because it's unsustainable. It's because leaders are making a choice to prioritize tax cuts over healthcare for millions of people. So what would this look like? It would look like potentially work requirements. States being allowed to require Medicaid recipients to prove that they're working a certain number of hours each week to stay enrolled. Most Medicaid recipients who can work already do. So this would mostly result in more paperwork barriers to cause people to lose coverage. It could look like capping federal Medicaid spending. Instead of guaranteeing federal funding based on healthcare need, Medicaid could shift to block grants or per capita caps, forcing states to either cut enrollment, reduce benefits, or raise state taxes to cover the shortfall. Do you see the game we're playing here? It could mean reducing provider payments. This means lowering the rates that Medicaid pays doctors and hospitals, which means fewer providers will accept Medicaid patients, creating longer wait times and access issues. If you know people who are on Medicaid, you know it's already pretty hard to find a provider who will take you. This also could look at rolling back Medicaid expansion. The Affordable Care Act expanded Medicaid to cover millions of low-income adults. Some proposals would take that coverage away, leaving states with a coverage gap and fewer federal dollars to support these programs. The average loss per congressional district, each district stands to lose approximately $2 billion in federal funding over the next 9 years, and an estimated 15.9 million people could lose Medicaid and CHIP coverage, which is coverage for children, by 2026 if states can't compensate for the reduced federal spending. So who would be hit the hardest by this? It's children, seniors, and people with disabilities and working families. Medicaid covers 40% of all kids in the United States. That means it means fewer checkups, vaccinations, and treatments for children. This also means seniors and people with disability. Medicaid funds cover 60% of all nursing home care. So this means families would be unable to afford long-term care. When you look at the way people are talking about long-term care, often it's not even included in, this is something that people have gone after for a long time. And our long-term care facilities are already stretched pretty much to the again, the fat's already been cut off. This would also impact working families. Millions rely on Medicaid because their jobs don't offer health insurance, and without it, they'll have nowhere else to turn. I have to take a drink of water, or else I'm going to start coughing. So, budgets are about choices, and I apologize. Right now, lawmakers are choosing, tax cuts over healthcare. And if we can afford tax cut for billionaires, we can afford healthcare for kids. If we can spend trillions on corporate subsidies, we can fund Medicaid for working families. So I'm going to start coughing, and I need to turn it back over to Andrew.
Yeah, and thank you, hey, Katie, for joining us when you're not feeling well. Just shows her commitment, I guess, to talking about healthcare, even over
I'm
health.
very passionate about it, and I'm so sorry, y'all.
Thank you so much. That was really, really informative, both of you. Okay, I'm going to zoom back and sort of talk about the moral messaging side of things, right? So a number of us have been speaking to lawmakers for the last few weeks, and there's a lot of contentious talks over like all of these spending cuts, right? As Katie and Sue sort of mentioned, you're going to hear a lot of confusing messaging out there that, they're just going to be cutting unused Medicaid programs or things that are corrupt or something like that, right? But when you really drill down to it, and ask like, okay, what specifically in Medicaid is corrupt? What's not being used exactly? Like, you won't get many answers. And that 880 billion coming from energy and commerce, that I don't know why Medicaid is under energy and commerce, but it is. That has to come from somewhere. So the moral voice here is going to be huge to talk about. We have experts like Katie talking to lawmakers about like, the numbers, right? But people really need to hear about the moral messaging here because that's really where this language of corruption and other things is coming from, right? We need to make sure that our values are in alignment and that people are being grounded in faith messaging. And I'll just say that from my perspective, it's been a pretty effective tool. And we need to really increase and make sure that voice is heard. So I'm just going to zoom out and just sort of talk about some of the social teachings that we have and some of the background that we also have. I'm not an expert on all the histories though, so please, like when you're doing your own advocacy, add to this, bring in other theologians and your pastors and your other faith partners, because it makes a huge difference. So back from the Lutheran founding days, Martin Luther actually had a lot to say about healthcare. He lived during a time of plagues and pandemics and other things like that, and was deeply concerned about public health, especially in cities. In his treatise on whether one may flee from a deadly plague, he wrote that we are bound to each other in such a way that no one may forsake the other in his distress, but is obligated to assist and help him as he would like to be helped. So this just really goes back to the core, right? We have this sort of group understanding of caring for people when they are in need, not running away from the leper, but running towards them, right? Lutheran theology also really emphasizes God's unconditional grace and love for all people and calls us to respond by showing the same love to our neighbors. I know that my youngest brother actually has special needs, autism. I don't know what our family would do without a Medicaid program like it exists in Ohio. And like the fact that we feel that sort of effort and like community gathering through the program of like all the folks who work to support my brother is like it makes a night and day difference. It would have meant the difference between whether or not like our family might have really struggled with our budget or not. So grounding things in our theology, our history, where we come from as people of faith, and our personal stories is huge. I'm also going to highlight a very, very cool resource. It's our ELCA social teaching on caring for our health, our shared endeavor, which can be found on our website. There is some great, even though this was passed back in 2003, it almost reads like you could have written this yesterday. And in it, there's a lot of different quotes about Lutheran theology that really can be useful in this context. I encourage you to, if you're interested, to maybe hold like study guide sessions on this as you're discussing Medicaid in your congregation and other things like this. And it is specifically affirms that access to healthcare is a matter of justice. Equitable healthcare access for all people is essential to a just society, it reads. This commitment is grounded in our understanding of God as one who desires abundant life for all people and who demonstrates boundless love for all creation. So when we're talking about the difference of financing and other things like that, just know that like our church, which has come together and talked about what is the grounding, the core like teachings of our vision, has really come together and supported this as a core priority. Finally, I'll also say, and Sue might get into this maybe, Lutherans have a lot of assets across the country that deal with healthcare. We have health ministries in our congregations. We have addiction treatment centers. We have hospitals, nursing homes, clinics, and other things dating back for centuries, right? We are committed partners in this work. So we should highlight that to people. You know, we are not just like people who talk the talk but don't do anything about it. We are people involved and invested in our communities when it comes to healthcare. So these partnerships with government are, they're not like, you know, we're not colluding or anything like that. We're working together for a shared goal to make sure that we have a healthy communities, period. And so with that, I think, and there is a lot more about that that I could go into. And if anyone wants to go deeper into strategic messaging, again, consult the social statement first, but like, you know, reach out to our office and we can see what we can do. And now I will pass it over to Sue for folks who are probably interested in how we can actually take action on this.
Yes, and there were a couple questions in the chat, so I'm going to attempt to share my screen again. I say attempt.
And we'll also have a Q&A at the very end, Sue.
Okay, thanks, Andrew. So we do have a Medicaid webinar on March 20th. We've invited members of the House Energy and Commerce Committee, staff from the Energy and Commerce Committee, to join us to kind of talk about where they are in developing their work, you know, as it relates to tax cuts and Medicaid, and to hear more from them specifically about what's going to be needed. So, but I think one of the questions in the chat was about, right, what could be cut, right, related to Medicaid. So there's a variety of ways Medicaid could be cut. In the last battle that LSA was involved in 2017, right, I mentioned it was a broad repeal the Affordable Care Act, right? And things like block granting Medicaid were on the table. Amongst others, right? But now where are we, right? With the tax cut conversation, with the Medicaid cut conversation, right? So there's things in the mix here. You might hear like per capita funding, which would reduce, right? You could see the level of cut, 900 billion over 10 years was forecasted. And that really works by having a cap on each person covered within Medicaid, so it doesn't take into account, right, natural disasters or things that would happen to people in the course of their lives. So it would limit services to them. And then the other thing we're hearing more about now in the last week or so is it basically preventing provider taxes at the state level. And that the state, right, it's Medicaid is a federal state partnership. And so when we were talking earlier about state budgets getting challenging, the way 49 out of 50 states pay for their share of Medicaid is through provider taxes. So if you take a state's ability away to use those as the payment for Medicaid, essentially you're taking away the state share, which would essentially, right, it's not quite 50-50. It's based on a formula how Medicaid works in each state, that you're essentially taking away the way the states pay for those services. Katie talked about budget reconciliation. This is the timeline from Speaker Johnson that we think we're working in, right? Katie talked about that they're in conference committee. Right, the committees are doing their work to come up with those cuts. That's happening now, right? And they hope to have a budget reconciliation on the House floor by Easter, and then final passage, Senate and House, of a bill by Memorial Day. We don't know if they will stay on this timeline, right? The government funding ends on March 14th. That's the battle ahead of us right at the moment. There's also a debt ceiling that expired in January that has to be addressed. So there's a lot of work for the Congress to do, but we think they've largely stayed on this timeline so far. So we have to be prepared to meet with members of Congress now. And someone asked about how much are we talking about, right? And I think Katie mentioned this as well, but in the House, which, right, remember what I said, we're largely focused on the House because there's a slimmer majority there, right? It was 2 seats, and now we just lost Congressman Sylvester Turner very unexpectedly. The former Houston mayor passed away right after, or as part of the State of the Union during that same time frame. So it's actually a 3-person vote for the time being until that seat is filled. But so we're focused on the House. The House last Tuesday passed a reconciliation bill calling for 4.5 trillion in cuts to pay for those tax cuts for the wealthy, right? The estate tax, individual income tax. 880 billion of that would come from health programs, right? And again, the only program with that kind of funding that's on the table is Medicaid. So that's what we're talking about, right? And as Katie said, the Senate has taken a different approach. They're starting with a $1 billion target as a floor, but we really see the House differently this time. Usually we're more focused on the Senate. This time we're more focused on the House. So meeting with your House of Representative member, still meet with your senators and meet with your governor, because the governors are going to be left holding the bag if provider taxes are on the table. Like, that burden's going to shift big time to the states. So it's important to also talk with your governor's offices as well. But we do have I'll put a link in the chat. This is our one pager. If that messaging is helpful to you, that's a recent publication. And I'll also add that we have the March 20th web forum with House Energy and Commerce Committee staff. And we're working to support our members in target districts based on those committees I talked about. So if you have any interest in joining those meetings with us, please follow up with Andrew and let us know, and we will slot you in as we're scheduling meetings if you're interested in that. So that's some of our next steps, and I'm going to pause there and turn it back over to you, Andrew.
Sure. And I'll also, if you don't mind, Sue, highlight that you did a great Medicaid action alert a month ago, right? That we recirculated to our network, just encouraging people to call their members now. So whether you're in a meeting or not, I would say, like, use that, and I'm sure we can maybe reshare that in the chat shortly. Okay. All right. I think now would be actually a good time for Q&A. So I'm going to turn it over to Joey, and I guess we can just sort of host a panel as we can. And thank you for Joey for putting the action alert in the chat too before this.
Yeah, no problem. Well, thank you, Sue, for answering those last two questions. There was a earlier one where someone was asking if one of you could comment on individuals that are under waiver services who have in-home health care, because if they're removed from Medicaid, they would not be able to get the care they need, but this also would impact the income for the provider. So if any of you are able or willing to speak to that, that would be appreciated.
I can't speak much more to it other than, yes, that would be very bad. And there's this is the unfortunate like impact of cuts, that there's, you know, a cascading impact. And you know, we know that like work requirements or restricting access doesn't actually help you know, folks who need care. In terms of like people's individual, like how they would be impacted, you know, I can't speak specifically to that. But like the federal, you know, policy side of it, like we know that cuts don't, that they don't work. And I think, you know, it's all back to poverty as a policy choice, right? Like the people are impoverished because we're making policy decisions. These are problems we can solve, and are making a choice not to.
Yeah, and I think the only thing I would add to what Katie said, right, it's a right, just reminding ourselves it's a federal state partnership. So each state has a state plan essentially for Medicaid, and it will get, you know, how those cuts get implemented is very much a state by state decision, right? There's parameters that come from the federal government about what can be provided under Medicaid. There's waivers that, right, that states are using for flexibility. So, you know, it's going to come down to your states, right? And that's why I'm saying reach out to your governor because the governors are very concerned about these cuts to Medicaid because they know they don't have the budget, right? They don't have the available funds in their state budgets to cover the gap. So it's important to communicate no cuts. You know, our message, what we're asking our members to say is no cuts, no caps to Medicaid. We're not going to accept any cuts or caps to Medicaid. And that means whether it's work requirement, per capita caps, state provider taxes, we're not in favor of any of them, right? Because it's going to limit eligibility and enrollment in Medicaid, and take people off that are currently on Medicaid, right? And it's, as Katie said, it's already not that easy to access Medicaid.
I'll just add to, again, we can't really comment on individual circumstances, but just from what I've been hearing from Hill offices, you know, like some supporters of these cuts are basically saying like, oh, we're not going to try to target like what they call traditional populations, like people with disabilities aren't going to be affected. And as like both Sue and Katie sort of already said, these can be cascading effects, right? And so it's kind of really hard to know that even if like sort of that population isn't targeted, if the whole budget is being slashed to ribbons, you know, and states aren't making up that funding, like there could be impacts, right? So that top line of just saying no cuts whatsoever, you know, is an important line to stick to.
Thank you for answering those questions. And just a quick note, I think there were also a few folks with their hands raised. We'd encourage you to use the Q&A function if you're able to, so that we can see the question in the chat. I feel like you all already answered this sort of in some capacity about the action alert, contacting your representative. Beyond those two things, is there anything else you would encourage folks on the webinar to do? I think there's a lot of energy from all of us here and people that we know that would like to be involved in taking action. And so any additional guidance on that would be appreciated.
You know, I would just say, you know, I just put in the chat the link to our advocacy alert, and you can use that to take action. You know, that's the minimum, right? Everyone should do that. but then take the next step. If you haven't reached out and asked for a meeting, it's important to do that, to talk about, some people get very nervous, right? About what am I going to say to my member? Please don't worry about that. This is about articulating your perspective about how this is going to impact your community. And that's really what's important to convey. What's going to be lost if Medicaid is cut, that's what we need to be able to articulate. And no cuts, no caps, right, is the message we're trying to get across. So that's what I would say.
I would also say the opinion section of the paper is the most read. So write a letter to the editor. I'm sure your ELCA folks have samples or talking points that they could point you to. But it's, I recently moved to a small town from Washington, D.C. And I love to write letters to the editor, and it's actually pretty easy to get published. They just won't publish me more than once a month, which is fine. But it makes an impact. I was walking through town and I wrote a letter to the editor, and someone was like, "Oh, you're the person who wrote that." And like, she was like, "I was really glad because someone said a thing that I agreed with, and I didn't know there were other people out there who agreed with me on that." And lots of people read it. Also, if you mention your member of Congress by name, it will show up in their press clips, and they will read that people are writing about them in the paper and saying, "Hey, what are you doing about this thing that I care about?" And again, it feels like it's a high lift, but it's not. If you write from the heart and then use some of the talking points that your ELCA folks have put together for you, it is a high impact thing that you can do.
And I'll just add, if you sign up for the ELCA Action Center, I'm assuming most of you are on here if you're already on this webinar, but maybe for those on the recording, please sign up to those. We regularly share updates from LSA as well, who are like, keeping us all like on the fore of taking action too. So if you're interested in upcoming alerts and other things like that, not just on Medicaid, but on other things like SNAP, because we're only touching one angle of this budget reconciliation process here today. Please consider doing that as well.
Yeah, and I just
And I think,
dropped the link to that for anyone who would like to. Sorry, go ahead, Sue.
no, I think, Andrew, what you just said reminded me of what we saw with the initial House vote on the budget resolution, the first step in the process Katie discussed. We saw some moderate House Republicans, voice and say they were a hard no on the resolution, and they ended up voting yes. And, one went on the record from Indiana, and if I can find the clip, I'll share it, but saying like there was so much pressure from the White House. She was very pressured by this White House. So even where we feel like we have commitments, we can't really take anything for granted. I saw some of you saying, well, I have Democrat House members. I think it's still worth reaching out to make sure that they're aware of your concerns, and also ask them, like, from your perspective, what else do we need to be doing, right? Who else should we be talking to? Because there's probably members in their state that aren't on board or in a different party, and they probably need some shoring up. Right. So I just want to say, we just can't take anything for granted. We just, there's a lot of pressure in ways we haven't seen coming before from the White House. So I think this is an unprecedented time, and we have to treat it as such.
Thank you for sharing that and answering those questions. I'll also drop in the chat a recent post from our blog, which also goes into a little bit more detail on not only the things that you could do to support Medicaid, but a little bit more detail and also understanding certain proposed changes as well. So if any of you would like to take a look at that, that's in the chat. So we've sort of talked about talking with our representatives and doing more public facing work. There was a question earlier about whether or not any of this info would be shared with congregations and churches. And I think, I would encourage anyone on this call to be having conversations about this with folks at the places that you worship. I'm wondering though, maybe if any of the panelists have any suggestions or advice for how to bring some of this information to folks in our churches, as it's, I think quite complex and there's a lot going on. But if there's anything that you would just suggest they do when trying to talk about this in our houses of worship.
I mean, I would just say, we're encouraging our members to reach out to their pastors, other religious leaders, including of different faiths, because we know this is a all hands on deck, right? And the more folks are coming together in coalition, the more important it is, right, to reflect that these are broadly held values, right? So it's not a time to act alone. It's a time to act in partnership and in unison, and no time like the present, right? So I was with the Jewish Human Services folks that were in town this week to go to the Hill, and I'm encouraging, right? I'm trying to connect their members with our members because we're all in this together right now. We need each other. And I think as faith leaders, more than ever, we need to be relying on faith and our faith leaders, especially in our communities. And I know our members are eager for those partnerships where they've had them, but not in quite the same way or need.
All reasoned. I don't have much to add to that.
I know there were, in addition to those questions, there were also just a few more practical questions. I know that this meeting will be recorded and will be sent out later. Is that correct? Okay, and then there was also a question about whether or not the slides could be shared, which I'm not sure about that specific one, but okay, thanks, Sue.
Yes, absolutely. I'll send them to you, Andrew.
Okay, awesome. Is there any, I guess, do any of you have any other ways you'd like to share with us about how we can continue to keep up to date with the work that you're doing, or the offices or organizations you're a part of are doing, so we can continue this work beyond the webinar?
While they're out there, I saw a number of people mentioned in the chat, they're coming to DC, or what's my contact email if they want to get involved. I'm putting in the chat, our office email is washingtonoffice@elca.org. That's our general inbox, and you can easily get a hold of me if that on that. Also comfortable sharing my own personal email though. It's andrew.fuller@elca.org if you want to just get right to me. It's been increasingly busy, so I prefer if you hit the general inbox first, but if say you are going to be in DC within a week or something and you need a rapid response, let me know. We try to host Hill visits if we can manage it, if you give us enough notice. Also, we love trying to schedule in district meetings and other things like that. Lawmakers are really, really loving sort of talking to constituents directly increasingly. Yeah, those are other ways of taking action. It's a bold step, but honestly, in my personal opinion, the more time it spends to do something like holding a meeting, spending time to get to know your paper and write that LTE that Katie mentioned, the more influence it will carry.
Yeah, and I think for some of the other organizations, there are also links in the chat as well that I encourage you all to take a look at as well. And to go back to some of those that have a little bit more detail and a little bit more content and information to look through. I think we probably have time for maybe 2 more questions. One of them, one of them was asking about how folks in states where it seems like the governor and the senators and the representatives are in lockstep, which I think goes back to what Sue was talking about, some of the pressure that folks were under who, said they weren't going to vote for for the recent budget resolution and ended up voting for it. But I think I'll sort of reiterate what some of our panelists said earlier, which is that, you know, contacting your representative or making an effort to set up a meeting, it may seem like a small thing, but it really does make a difference. One of my roles, and I apologize, I didn't introduce myself, but I'm a hunger advocacy fellow with ELCA Advocacy. And sometimes I, along with my colleagues, on the Hill, meeting with different offices or just dropping in to convey things that we are discussing in our office, or specific issues that we are working on. And every once in a while, there's someone in an office who will say that they already have a number of constituents who have talked to them about this issue. And it's always really encouraging to hear that, because sometimes we'll go into these meetings and we're not sure if we're the only ones saying these things, but they make note of when there are constituents contacting them, whether it's by phone, whether it's by email. So it is important, and I think any little bit helps in the environment we are in right now. Katie, did you want to add to that?
Yeah, I guess I'd also say, if the only folks that they hear from are people that agree with them, then they're never hearing someone who disagrees with them. And so you know, it doesn't, because it doesn't feel great. I acknowledge that my whole career and a lot of other advocates, a lot of it is talking to people who maybe disagree with you on a lot of policy things, but you're still going in there and you're saying, I'm a constituent of yours. You represent me, and this is what I think should happen. Or this is, what I believe. And if they only hear from people who agree with him, then they only hear from people who agree with them, and then that's a a cycle that we don't want to perpetuate. So I always share that with folks when they say, well, this person doesn't agree with me on most of the things I believe, and I'm like, that's why it's all the more important for you to go talk to them.
Yeah, to the same vein, more or less repeating what you just said, Katie. Like, you never want to give a lawmaker the excuse to say, I didn't hear from any constituents on the other side of this issue. Like, you can have them do like pretty nasty votes, but you never want to give them that out. You know what I mean? And frankly, I think people who do like sort of send to messages to lawmakers who probably don't agree with them, like those minds will slowly change. They will, like, if they get enough pressure quietly, they might not put a press release out there. Might not scream and just magically turn their opinion, but they probably will go to their leadership and basically be like, I cannot be seen voting on this. You know what I mean? And that could make a difference behind the scenes as well.
Thank you. And yeah, I just dropped another document as well, and a few tips for holding virtual Hill meetings, which have become much more common after the pandemic, and I think are also sometimes even more effective or more powerful coming from folks who are literally in the actual district itself, rather than visiting in Washington, D.C. So you can take a look at that if you would also like to set up virtual meetings. So yeah, this meeting will be recorded and more information will be sent out. We have probably time for one more question. I would be interested in hearing from the panelists about something, maybe just something that is inspiring you in this environment we're in. I know all of you are working extremely hard right now and are, under a lot of pressure doing the work that you're doing, but what's been inspiring you or keeping you going in the work that you are doing?
I guess I can go first. Joey's point was actually right. It is really inspiring to go into a Hill office and being like, hey, you probably don't know about us, we're the ELCA. And they're like, oh, we know exactly who you are. Your people have been ringing us nonstop. You know what I mean? That will warm your heart like nothing else. So I've been overwhelmed by how active and passionate Lutherans have been. especially recently, it's been really amazing to sort of see the action and how how folks want to get involved. And so really, I feel like really humbled to sort of work for a denomination that's has so many people committed to justice. It makes such a difference. And yeah, and I feel like we can do a better job sharing those stories because people are being really, really active. We just need to communicate that louder and harder. So I'll just be sharing my gratitude, and that's what's inspiring me.
Yeah, I mean, I think that's it. It's community, right? And church is community, and it's the people who are, showing up when it's hard, because it is hard and it has been hard. And we hold each other through all of these times. I think that's I don't know if that's what inspires me, but it's certainly what sustains me.
Yeah, and there are bright spots, right? Yesterday we saw the judge uphold USAID's funding, right? The Supreme Court upheld that it has to go out, right? So I think the legal process is not moving as fast as we would all like, but it is moving, and we have to hope it keeps moving in the right direction, right?
Well, thank you all for sharing. The last thing I'll drop in the chat is the link to the ELCA Advocacy YouTube channel. So the webinar will not be uploaded there immediately, but eventually you'll be able to find it there. And if you subscribe to the channel, you'll also probably get a notification. So yeah, Andrew, was there anything else, or is that?
Yeah, if it's all right, I can close this out with prayer. All right, and thank you, everyone. Okay, let us pray. Loving God, as we conclude our time together, we ask for your blessing on our work ahead. Give us wisdom to understand complex issues, courage to understand, compassion to center the needs of the vulnerable in all of our advocacy. Strengthen the hands of all who provide healthcare services. Open the hearts of policymakers to prioritize human needs over political expediency, and comfort those who live uncertainty about their healthcare access. Guide us now as we depart from this gathering to be faithful witnesses to your love and justice in the world. In your holy name we pray. Amen. All right. Thank you, friends and advocates. We will look forward to staying in touch. And thank you to the panelists for spending the time to talk to us all. Really appreciate your wisdom.